Hi, I'm Dr. Maggs. Welcome to the Concerned Parents of Young Athletes Sports Medicine Podcast. This is brought to you each week, and our target market or target population is youth sports, or technically middle and high school athletes. That's an age where there's massive growth, and you have young bodies that are under just tremendous stresses. Adding to that, the emotional stresses of going through adolescence and all of the things that come with it. And our Concerned Parents of Young Athletes program has just focused on that group for the last 20 years. And we've developed what I believe to be a much superior program to take care of these young athletes. Currently, these young athletes are under the guidelines of our health insurance industry. So they get a medical exam at the start of the season, and then they react to injuries. They only go to a doctor when they become injured, and they go to doctors that are not trained in musculoskeletal. So you can see the whole system is turned on its head. So tonight, I'm going to go through uh, a process of what each of these kids should be getting and how it would benefit them. So the news this week is the sports exams, because now we're entering kind of preseason before the school year starts. And let me tell you what you need to know. We just had an article come out in a recent paper a couple weeks ago. Injury prevention begins with youth sports. So I have been at this now for well over 45 years dealing with athletes. And we have a saying that the body keeps a perfect scorecard of every banana peel you ever step on. So these stresses accumulate in the body. We also have a saying that youth hides a lot of sins, and those are biomechanical sins. So we know that everybody is asymmetrical, everybody is biomechanically imbalanced. We've just developed a test that can detect those imbalances, and there are many ways that you can make modifications and corrections to balance the weight distribution in the body. So it's not rocket science, it's just that we look at it differently. We're proactive in prevention, not just reactive, and that's where the system needs to get to. So here is a local school district in their exam form that starts the season. And you can see that eyes, ears, lymph nodes, thyroid, nose, tonsils, teeth. But if you go to the next column over, far right, and if you go all the way down to the bottom is orthopedic, and the test is feet, posture, structural. Now, the average doctor that does these examinations knows very little about what is normal biomechanics and what is abnormal biomechanics. That's not what they do. So very often it's just skipped over, or it's asked, how are your feet? How's your posture? But then scoliosis. And what I've learned is that scoliosis is kind of the only word the medical community knows when you're talking about the musculoskeletal system. So very often it'll be overplayed in the evaluation. We're checking for scoliosis. You have a little scoliosis, and they do an external exam where they have the young athlete bend, and they try and visually see, and you just can't do that. So we had a mother come in about 3 weeks ago, getting her son sports physical. I think he was 13 years old. And she came in because the doctor that did the sports physical said, I think your son has a little scoliosis in his thoracic spine. I think you really need to have an x-ray. So the mother brought the young student in to be x-rayed. And I said to the mother, I said, listen, let me tell you something. I've done thousands of musculoskeletal biomechanical exams on middle and high school athletes. That's not your concern. Scoliosis is so remote, and it's one of those conditions that you can't affect it that much, but there are many contributors that have an effect on scoliosis that they are ignoring. They're not looking at it. And we want to look at it. So I said to the mother, let me do my exam. I don't think we really need to do a scoliosis x-ray. And she kind of pleaded with me. So I said, okay, I'd be happy to do it, but I have to do my exam too. And she agreed to that. So we took his x-ray for scoliosis. And as you can see, that's probably the most perfect looking thoracic spine we've seen in a long time, because many of at this age have mild curvatures in the spine. but it's not a thoracic issue per se. It's an issue that starts at the feet because the human body is an architectural structure. So if there is more collapse of one foot than the other, if there's an increased Q angle of the knee where it's rotated in, if there's a leg length difference, the body compensates for all of those imbalances. And those are the areas that you need to examine for these young athletes, because that's what's going to influence whether tissue is stressed, whether tissue is overloaded, and whether tissue will become injured or not. So the costs of handling it the way we handle it are extraordinary because, first of all, you have to pay for the examination that young man just went through. You have to pay for the x-rays that are inappropriate x-rays. And then the cost of not identifying what this young man does have leads to premature injury, long-term premature degeneration, long-term medicine, pharmaceuticals, surgeries, disabilities, loss of quality of life. It's enormous. The costs are enormous. So this is every young athlete. The collapse starts at the feet, increased Q angle of the knee, unlevel pelvis, and the upper body compensates wherever it has to go to find balance. We have the examination that looks at those imbalances, our structural fingerprint exam. And here is an example of a young man that came into our office years ago. You can see the left foot is collapsed, the left knee. They call that an increased Q angle. If you look at his quadricep muscle, how disengaged it is. If you look at his shorts, you can see that they probably reflect unlevel hips in his body. So this is a young man that in a current medical exam scenario, no one would ever identify these imbalances. And we, over the years, have come up with the Mag's law of tissue tolerance. When the loading of a tissue is muscle, tendon, ligament, disc, meniscus, it doesn't matter, bone. When the loading of a tissue exceeds the capacity of that tissue, then physiological changes occur. So these changes are occurring every day in our young athletes. They don't have to be symptomatic, but the body is adapting to the abnormal weight distributions. And what does that lead to? That leads to the Tyrese Halliburton rupturing his Achilles in the 7th game of the NBA Finals. That leads to Jason Tatum, Aaron Rodgers. It leads to these injuries down the road because over time there's such an accumulation of stresses that the body can't get rid of or dissipate, and those accumulations build up to where the tolerance of the tissue is dramatically reduced, and the straw that breaks the camel's back is a true concept. So that's the Mag's law of tissue tolerance. It applies to every young athlete, and our goal is to elevate the tolerance of the tissue by balancing the weight distribution in that young body. And then it's a management issue. It's not a one-time thing. There are proactive things that can be done to these young athletes on a regular basis. Our system isn't using it. We have the wrong doctors in charge, the wrong model, the wrong protocols in charge. So the structural fingerprint exam is a comprehensive biomechanical exam that I've done on thousands and thousands of kids, and every young athlete is 100% unique, and every young athlete has biomechanical faults. So we've got to elevate this message to get it out there. We've got to train doctors. We've got to make the industry understand there's a better way, and we've got to get everybody working on it because this population, this generation, is at severe risk. So here is the x-ray we took of this young man, and you can see his left hip is 4.6 millimeters higher than his right hip. 3 millimeters and below is optimal. But this is a combination of two factors. One, the collapse of the feet, because he's barefoot with this x-ray, standing, and the other is the length of his leg. So what we do is we are going to now put him in orthotics to remove the feet from the equation, because the orthotics will create symmetry and support for those feet. So now the foundation is symmetrical. Here's the side view, and to the left is his stomach, to the right is his buttocks. The long red line, vertical line, is his center of gravity. It should be going right through the short red line. We now know, after taking literally thousands of these x-rays and following these athletes and seeing what injuries occur, we know what injuries are that this athlete is predisposed to, because the stresses are not going through the areas of that spine that are designed to handle those stresses. So there are specific injuries that this young man is already predisposed to, and there are a variety of things that can be done immediately and on an ongoing basis to dramatically reduce the risk of injury and to keep this young athlete safer. And that's what we need to do. So we've developed the Dr. Mag's Feet First system because after doing or examining thousands of these young athletes, we know that the collapse of the feet is universal. We start with orthotics, and we use an over-the-counter orthotic. You can use custom, you can use over-the-counter. The higher the quality the orthotic is really the key. Ours are very high quality over-the-counter, creating symmetry and support. And then we retake that x-ray. Now, in his particular case, it's virtually identical. So that means it's not below 3. So we have to use a lift under his low hip orthotic to create level in his hips. When you create level in the hips, now the weight distribution going through his lower extremities will predictably be more balanced. The levelness of the hips will also allow that spine to now sit on a more level foundation, creating balance in the musculature and the stresses going through the spine, and over time will reduce injuries. But there's more information to be had regarding this issue. This is the visual of what we want to do with each athlete, the before and after. The after is made up of a variety of steps that we take to get that athlete in that position, but it's not a guarantee that that athlete's staying in that position, because as they grow, they don't grow evenly. And I'm going to show you a slide to prove my point. This is the same athlete at 13 years old, had a 6.3 millimeter difference. At 15 years old, had a 7.7 millimeter difference. And at 17 years old, had a 10.3 millimeter difference. So our recommendation is that we have to do the initial structural fingerprint exam on these young athletes and then do what we know how to do. And then every 18 months to 2 years, or if there's a major growth spurt, we have to take one x-ray of the hips to be able to put the appropriate size lift underneath if a lift is needed, but just to make sure we're managing that difference in their hip height as well as we can. And that is the foundation of the structural management program and the structural fingerprint exam. So there we have it. My goal is for every kid in the country to go through this exam, start going through the corrective measures that can be done immediately, and start going through the treatments and the exercises that are unique to them that will keep that body healthy, keep the stresses at a minimum, and keep the tissue tolerance at the highest level that it can be for each athlete. Versus today, which is unaware of all of that, and they're treating kids that are being injured after the fact. So we've got a lot of work to do. Again, I'm Dr. Tim Maggs, Concerned Parents of Young Athletes. Work with me, help me to build this, and let's see if we can change the outcome in this country for the better. Thank you.